common causes of faulty radiographs. That means common errors that we have in intraoral radiography. Okay, so you have this only as in one page in your textbook, reference textbook. It's in page number 678 in the textbook, but when you open the PDF file, it will be in page 700 and something. Okay, so the numbers will be varying because of the introduction part and all those. So common errors in radiographic exposures, it can be because of the projection technique or the processing techniques. Okay, projection means when we angulate the X-ray beam with the help of the cone. If the vertical angulation is not correct, we get either foreshortening or we get elongation. Foreshortening when we keep too much of vertical angulation means increase in the vertical angulation, and elongation if the vertical angulation is less than the actual one. For example, if you keep 35 instead of 40, you will get elongation. Okay, so these two are projection errors because of incorrect vertical angulation. So like that, you will get errors in horizontal angulation, which is called as overlapping. Okay, overlapping between the teeth, which appears as more white or radiopaque area between two teeth. Okay, this is because of incorrect horizontal angulation, and one more is there due to projection. Projection means always angulation of the X-ray beam. Okay, and the other one, the last one, is the cone cut. Cone cut or partial image, or you can say incomplete image, it is because of incomplete coverage of the X-ray beam with the sensor or the tooth. Okay, so here the point of entry of the X-ray beam will not be correct. That is why we have a cone cut. Especially these projection errors are possible when the arches that we are going to expose, maxilla or mandible, they are not ideal arches. Ideal arches will have a good or enough space to keep the sensors or the films well inside, like a good or deep floor of the mouth or deep palate. Whereas if it's shallow, there need to be alteration in the techniques as you do in the lab. Sometimes you need to increase the vertical angulation. That time, sometimes it can end up in the projection errors like cone cuts, incomplete coverage, all these things. So all these errors which occurs because of adjustment of the cone and the X-ray beam, it's called as projection errors. Okay, we have also processing errors. Okay, processing errors and storage errors, all these things. Also, exposure factor errors. Exposure factors are the current, the time, and the voltage in the circuit. So in the intraoral machine, the voltage is constant. In the extraoral, it can be changed. Okay, so the more concern that we have is with the time and the current, that is seconds and milliampere, MAS, that we see as the red color display in the control panel. Okay, so we have dark radiographs and we have light radiographs. Okay, the reason for light radiographs can be exposure factor errors or processing errors. Okay, the exposure factor errors means, for example, you want to take a molar exposure and you had selected incisors of mandible, which has a least exposure among all the teeth. So the amount of exposure that was required for maxillary molar was not sufficient because the exposure button was selected to be mandibular. Okay. Then increased target to film distance. That means um, target is inside the X-ray tube head. If you remember, dental X-ray tube has a tungsten target. So sometimes in the textbook you will find target to F film distance or focal spot to film distance, TFD or FFD. So D is for distance and the F in between is always the film. And T or F, it can be interchanged. Either they will say target to film distance or focal spot to film distance. Okay. So increase in the distance between the cone and the image receptor can also result in light radiograph. So increase in distance means if you have to take a canine exposure and you are keeping the cone around 20 centimeters away, so that is an increased distance from the target to the film. Okay. Minimum distance that you have to keep with the skin is 2 to 2.5 or 2 to 3 centimeters. Okay. It should not be more close than 3 to 2.5 or 2 centimeters. You can keep the range as 2 to 3. Some machines they say 2 and for some they say 3. So increase in the target to the film distance can also result in a light radiograph and backside projection. That means the label side projection. We have to keep the tube side towards the X-ray source. But if you keep the label side, the colored one with the triangular flap on which the speed of the film, the number of the film is written, where you have the lead foil backing, so if you turn around the film and take exposure on the left side, then you get a light radiographs along with tire track. This is the tire track appearance, okay? So you can clearly see the difference between both of them. The one that you see on the left and below, these are called as tire track appearance. You will see this print or design only on two sides, one and on the other side. Okay, so in case of herringbone pattern, you see this pattern is called as herringbone pattern. It's there in the entire film, whereas tire track pattern, it's usually seen on two sides of the film. Okay, so here you are not able to appreciate the other side of the tire track, but at least one side you can see that it is tire track appearance and it is not there in the entire film. Okay, so tire track appearance and herringbone pattern. Okay, these are the two patterns which you can see if you keep the back side projection. Very important question for your final exam or for your Saudi dental assistant licensing exam. Okay, then comes the processing error. In case of processing error, there is underdevelopment. That means less time in the developer. The developer solution is cold if it's in the dark room, or it is diluted too much. Okay, if you remember the processing chapter, there is powder, liquid concentrate, and ready to use liquids. Okay, powder, it has to be mixed with distilled water. Liquid concentrate, it has to be mixed with distilled water. Ready to use, it can be directly used. So there is no question of dilution there. But in the case of powder or liquid concentrate, when you mix with distilled water, it is possible that sometimes you end up making the solution underdeveloped. Okay, so in such a case, if you see a light radiograph, then it means that the concentration of the solution has to be increased. So you need to top up the solution with little bit more concentrated solutions. Okay. Depleted developer, the first one who processes the radiograph, and the last one, for example, maybe there were 50 intraoral exposures done on the same day. So the first one will have a good density and contrast, the good color of the radiograph. Whereas as the time increases and it ends with the day, the color of the radiographs will become more lighter because of depleted, that means used up developer. Also, if you are keeping the film in the fixer solution for longer time, then the fixer is going to remove the developed areas, that is the black areas also. So that is why it is instructed, especially when you are working in a place where it's completely or partially film based dentistry, then it is very important that you do not forget the film to take it out from the fixer solution after the specified time. If you leave it there long, it is going to become a light radiograph. Sometimes, if you leave it overnight, by morning when you come, it is going to be completely blank because the whole details of the silver halide will be completely removed and dissolved by the chemicals in the fixing solution. So you will find only the film base clipped to the hanger. Okay, so the reasons for dark radiographs are just the opposite of the light one, but here we don't have the lead tire track or lead herringbone pattern because there is no lid foil in the front side of the film. So this occurs when the film is kept with tube side towards the X-ray source. That means the identification dot is towards the X-ray source itself, the raised portion. Okay. But here the exposure factors are more and there is less distance between the target and the film. That means the cone is very close or maybe it is in contact with the skin. So that time it can result in a dark radiograph. Okay. Then comes the processing error. In the case of processing, if you remember light radiographs, less time in developer, light films, and more time in fixer, light films. So just the opposite here. More time in developer and less time in fixer. So these two can lead to a dark radiograph. Okay. The other conditions are exposure to light. For example, you forgot to switch off the white light in the dark room and you open the film packet. So the safe light, that is the red light, is on, but the white light is also on. So an exposure to the light takes place and the radiograph will turn black. Improper safe light. So safe lighting, it means that only the red light should be on in the dark room when you are doing the processing. If the white light is on or if there is any light leaks, it means that your radiograph is going to get exposed. It'll become more darker or it is going to get fogged. Fog means unclear images. Okay, so safe lighting is one of the important things in a quality assurance in the dental office. Okay, so there is a method to test the safe lighting. It is called as the coin test, or sometimes it is called as penny test. Okay, so this is to test the safe lighting inside the dark room. That means we want to ensure that there are no light leakage or light leaks inside the dark room. Maybe it can be through a small crack. So if that occurs, you have to seal it with a black tape. Okay. So how do you do a coin test or a penny test? You can expose the film with any object or tooth, and then you are going to switch off the white light inside the dark room. The safe light, the red one, will be on, which is around at least 4 feet away from the processing table. So you can keep the film open maximum 2 to 3 minutes. After that, the film starts fogging. Okay, fogging means it will appear a little bit blurred once you are developing. Now, when there is an improper safe light, that means light leakage, at the time, if you keep the film out of the film packet and then place a coin on this film and just wait for 5 minutes. After 5 minutes, process this film. So you peeled the film packet, opened it, and you removed the film outside. You placed the film on the film packet and you placed a coin on the film. 5 minutes you waited and then you started developing, rinsing, then fixing, and then finally you washed it. And when you dried it, you saw that there is a outline of the coin on the film. If you see the image or outline of the coin on the film, that means the dark room is not light proof. There is light leaks inside the dark room. Okay, so coin test or penny test is one of the tests which you use to check the safe lighting inside the dark room. Okay, so always remember, if light leakages are there, the films can turn foggy, it can get exposed, becoming making it more dark. Insufficient contrast. So density means the overall blackness of the image. Okay, overall blackness means, for example, if this image is too black, we say that the image is having a high density. If this image, okay, this image is having a high density. Now, this image, the overall darkness is less. So we say that it is a low density image. This is a high density image. So, a high contrast. Contrast means the difference in the densities. Okay, difference between the dark and the white areas. So, in the first image, you can see that there is more white and black areas, and the gray areas are less in number. That means the range of gray scale is short. So you call this as a short grayscale film with a high contrast. And these films are going to appear more light. In the case of a low contrast film, you are going to see that the white and the dark areas are less, the shades of the gray are more prominent. Okay, so you say that it's a long gray scale. It can occur in cases when the film is fogged. Due to high kVp also you can see such conditions, and the film will be dark. Okay, so these are the two types of contrast, high contrast and the low contrast. Okay, cone cutting or partial image. Improper point of entry, as we discussed of the central X-ray beam, it can result in a cone cut, or you can say a partial image. So beam alignment is incorrect with the image receptor, that means the film or the sensors, and the teeth. So if you remember the paralleling technique with the holder, in case of paralleling technique, you have a ring called as beam alignment device or aiming ring. So you can aim the cone perfectly with the ring, which will completely expose the radiograph. But when we use the bisecting angle technique, we don't have that beam alignment device. So it is obvious that we are going to get some kinds of partial image or cone cutting. Okay, so cone cutting is basically the white area representing there is no exposure on the image receptor, and it's usually triangular or arc shaped with a round collimator, as you can see in the image 1 or figure 1. You can see that it is arc shaped. It has a specific shape like the part of a circle. Okay, it is arc shaped, and this area, white area, it looks like a triangle. Okay, so that is possible with the round collimator only. And if you see the other two radiographs, you can see that there is a very clean cutting edge or difference between the white areas and the areas of radiographic exposure. So this is because of the rectangular collimators. Okay, the arc-shaped or circular area or triangular areas because of the round collimators, whereas the straight edges are because of the rectangular collimators. Okay, now fogging. So fogging means it is unclear image. Okay, unclear image because of some kind of unclarity. Okay, light fogging and processing fogging. So in our lab, we will not get the error of processing fogging. Why? Because we are not using any hot developer or hot processing solution. So we are concerned more about the light fogging, but we have to know what is the processing fogging that we can encounter. So one is because of the hot solutions, mainly the developer, or the higher concentration of developer, that means it is less diluted. Okay, or it can because of the developer solution has been contaminated. You had poured the developing solution in the container where you usually pour the fixing solution. So in such cases you can get processing fogging. Light fogging is because of an improper safe light leakage, also at times the radiation leakage. Okay, so the radiation leakage, it is ensured by the yearly quality assurance test of the radiology unit, which is undergone in every radiology setup. Okay, so radiation leakage, if there is any radiation leakage that is found, then the FDA or the SFDA here, they are going to ask the machine to be uninstalled and discarded with a proper, what do you say, disposal of the hazardous instrument. Okay, so that is how you're going to find out the light fogging. Storage fogging, it occurs again in the dark room where we store the images, the films. So the films should have a proper humidity and temperature for storage. If there is more temperature, more humidity, or the films are expired, that means outdated, then there are chances that the films that are stored in the darkroom becomes fogged or unclear. Films without the lead backing, like the extraoral films, there are more chances to get fogged than the intraoral films. Chemical fumes, as in new wall paints, can also result in some kind of storage fogging. Now, coming to the dark spots or lines in the radiographs. So, the reasons for dark spots or lines are many, like fingerprint contamination, black paper. It is still stuck along with the film when you were processing. You forgot to remove the black paper. Okay, then you also get a dark image. Film in contact with the tank or another film during fixing. So what happens if the two films are in contact? There will be no interaction of fixing solution in that area. So that area will turn more black. Films contaminated with developer before processing. If you're going to do the processing step and you accidentally spilled some developer before the processing was started, then those areas you get dark spots. Excessive bending of the film. You get to see dark straight line at one of the corners of the film. Okay, this occurs when the floor of the mouth or the palate is more shallow and the entire film or the image receptor cannot be kept or accommodated in the floor or in the palate. Okay, so in such case, there can be excessive bending of the film if you're using a film-based imaging. Okay, so that will leave a black line. Next is static discharge. So when you open blankets, you will see some kinds of current. It's called as static discharge. Okay, so um, it looks like a branchless tree appearance. That means, not branchless, sorry, leafless tree. It looks like there is no leaves on a tree. That is how a static discharge looks like. It is most commonly seen with extraorals because when you pull out the extraoral film suddenly, you can see the static discharge. Also, dirty automatic rollers, which has not been cleaned or maintained for maybe 1 month or more than 1 month, you can find that the roller starts getting dirty because they're continuously moving, and the developer and the fixer gets deposited in these areas. Okay, so these are the reasons for the dark spots or lines. So we'll see the images. Okay, we'll enlarge. So if you see here, you can see some kind of fingerprint pattern. This contributes to the black line in the image. Okay, there is a light spot as well on the image, which is because of a fixer on the film. Okay, then black paper sticking on the film. So you can see that there is a black paper which is stuck with the film. This did not allow that area of the film to be completely fixed once the developing was done. Then the next is here. You can see again there is a black image because of the excessive bending, as you can see here. Bending can leave a line. This is because of developer contamination just before the processing was started. Okay, developer contamination just before the processing was started. So these are the reasons why you get to see these kind of errors. Okay, so if there is a film in contact with other film during the time you are uh, processing, then it leads to image like this. Okay, one film contacting the other, you can see the edge of one of the film. Okay, this because of black paper and this because of films contacting each other. Then what you see here is the static discharge. It looks like a leafless tree appearance. In intraorals also you can sometimes see static discharge. Now here you can see again a black or dark spot on the film, which can be due to dirty rollers in the automatic processing. Okay. Now next is about the light spots. So light spots are because of fixer and dark spots are because of developer. Okay. So light spots, they are occurring because the film is contaminated with fixer before the processing. Okay, the fixer falls on the film before processing, it turns light. If developer falls on the film before processing, it turns dark. So film in contact with the tank or another film during development can also give you light spots or lines. Yellow or brown stains. So, yellow or brown stains on the film can be because of a depleted developer, that means overused developer, which does not have a strength, a depleted fixer, again, which does not have a proper strength or concentration, insufficient washing. If you do not wash the X ray film with more time in the washing after the fixing step, contaminated solution. That means you did not tap the X-ray film and remove the excess developer and took all the solution into the rinsing solution. From there, you took again some of the developer solution to the fixing solution. So such cases can contaminate the solution and you can see yellow or brown stains in the image. Blurring, movement of the patient, movement of the tube head, X-ray tube head, or a double exposure can result in blurring. So in the case of blurring, you can see that the sharpness of the image of the structures, they are lost. Movement of the patient, double exposure, and movement of the tube head. Okay, so these are the examples of blurring. Now, in your textbook, you have the summary of all these errors. So, in the case of sensors or films, also sometimes you get a completely unexposed image. Okay, here it's exposed to white light. So, before processing, the film was opened or unwrapped in the white light or outside the daylight processor. Number C is a high density radiograph. It can be because of overexposure factors or exposure factors or processing factors. So here it can be either overexposed or overdeveloped. Then D, it's underexposed. That means less developed because either of low exposure factors or if it's a processing solution, less time in developer and more time in fixer. Then incorrect image receptor placement. So here you can see that the film is not in line with the occlusal clearance. Okay, so the root gets cut. Incorrect horizontal angulation. So when there's an incorrect horizontal angulation, the teeth in that area becomes overlapped one on the other. Okay, so that is called as overlapping. You can do a correction of the horizontal angulation and it will be okay. Then vertical angulation too steep. That means there is too much of vertical angulation. Okay, so avoid those excessive angulation to get a good radiograph. Vertical angulation too flat. That means your angulation is lesser than the normal. Okay. PID not properly aligned. You can see there is a semicircular area. That means the position indicating device was not aligned with the central beam or the receptors. Okay. Film excessively bent. So if a film is excessively bent, then a black line appears on the radiograph. Then the film exposed twice. That means double exposure. So in such case, you can see that there are teeth that is more than one time exposed. For example, if you see here, there are two outlines of the same tooth. You can see one outline here, another outline here, and the main area of the tooth is here. So that is called as a double exposure. Again, a patient movement and resulting in blurring. So stabilize your patient, instruct your patient that it will take only 5 minutes time. You have to follow the instructions. If the patient moves, it will repeat. It will end in blurring, and you will have to repeat it. So they will listen to you, and they will take care that the film is exposed correctly. Then the um, the film place in the mouth backwards. That means the backside projection. Okay. In the case of backside projection, that means the lead foil is on the backside and the backside is angulated towards the X-ray tube. So in such case, you can either get a tire track appearance or a herringbone pattern along with a light radiograph. Okay. So these are the errors that you have to know.